We're going to talk about this great new benefit today, what it is, if there's any questions, what exactly it means to you, how you can participate, because we want everyone to participate. It is extremely important that we have this done. And we can all talk about the stories that we found our health. I can talk about my story. Joe can talk about his story. I'm sure some of you know someone who's found out something that was maybe not even that serious, but it was something that we need to take care of, or we need to make some changes for to help get better and healthier for your students. So just a little bit about Interactive Health, who we are. Sorry, I'm kind of in an awkward reading spot here. Interactive Health, we're based in the Chicagoland area. We actually have clients throughout the entire United States, pretty much every state in the nation. Last year we had about 1 million members go through the program that all of you will be going through in late February. We're growing dramatically, as you can probably guess, because of the healthcare problems in America. There's been more and more focus on preventative things like this, certainly in the last 10 years. We are the largest independent wellness provider in the nation, and of course fully accredited NCQA. We're the only wellness provider that is endorsed by the American Hospital Association. So all of the things on this page are saying we know what we're doing. We've done this with hundreds of clients, thousands of clients throughout the U.S., and we believe we're very good at what we do to help people get better. So we're very excited to be helping your district come February and March. So again, why are these health evaluations important? I always use this story, and Rick's probably heard this a million times, but I played football in college. I thought I was a great athlete, right? When I graduated, I hadn't been to the doctor in probably 8 years, and I started working at Interactive Health, and they started incentivizing me to do this program. I found out through my screenings that I was actually pre-diabetic. I found out through my screenings that I had high blood pressure. I found out on my screenings that I should stop using tobacco, which my wife agreed with. But all of these things, although they weren't incredibly serious, they were very important for me to know, because my family has a horrible history of diabetes. My family has a horrible history of heart disease. And these are now things that I can work on and be cognizant of throughout my life. Now, also keep in mind that throughout the term or the life that we're doing your screenings, you will have a history on your web portal. You'll have the hard copy packets that we'll talk about in a little bit, but you'll be able to see how you've progressed throughout the years, which is really valuable. And this is the test that we're talking about is something that you can take to a doctor, and a doctor would be able to diagnose different things off of that. It would be very similar to if you went to a doctor and they told you, you know what, we need to order up some blood work, some comprehensive blood work, to see what's going on first before I can diagnose you with something. So it's an incredibly valuable test, and we're going to be coming to all the different locations, like I said, in February and March, and we'll talk about that coming up. But the goal of the program, in a nutshell, is to ask you on a health risk assessment different questions like, do you have a history of diabetes? Has a doctor ever told you that you have high cholesterol? How many hours of sleep do you get? Are you a tobacco user? Things like that, all of which are confidential. That's very important. We're going to note that several times, that all of this is for you. It's for your information and your doctor, your spouse, or whoever you want to share it with. All of those things are confidential, but then we do pair that 38-panel blood work test with your health risk assessment. So what we're able to say is, well, you said that you weren't a diabetic, or you said that a doctor has never said that you were diabetic. The blood work is coming back and saying that you might be in that diabetic range. And then we're going to follow up with health coaching and things like that if you'd like to take part in that health coaching. So in a nutshell, that's what the program is doing, is identifying people who may not know what's really going on so that we can do something about it and get better. So who's eligible to participate? Again, completely free, and we talked about the Yavapai benefit trust here. If you're on that insurance plan, to you or your spouse, or retirees on that plan as well. What is included, we talked about briefly what it is. It's a mid-arm venipuncture, very quick blood draw. It draws a very small vial of blood, 38 panel. There will be some gender and age-specific tests on that. If you indicate that you're a diabetic, an A1C test will be automatically ran on that blood work, so you don't have to get it tested again or anything like that. If your fasting glucose comes back over 100, which we at Interactive Health consider to be pre-diabetic state, an A1C test will be ran as well. If you're a female over the age of 40, you will automatically receive a TSH test, which is a thyroid-stimulating hormone, very important for women over the age of 40 to get. And if you're a male over the age of 50, you'll get a PSA test on that blood work automatically done if you indicate that, obviously, on your health risk assessment that you're over 50, which is a prostate-specific antigen, which is important for men over 50. So all of those things, all of those extra tests will be ran on the standard 38-panel comprehensive screening. If anyone is interested in seeing that, just contact me afterwards. I can give you the complete panel to show you the breakdown of the different tests. But there is also a blood pressure screening done very shortly beforehand. So overall, what you end up doing is signing up for your appointment in the morning. It is a 12-hour fast, and it literally takes about 4 to 8 minutes. We say 8 is really the high end. It really takes about 4 to 5 minutes. So you're going to pick your specific time that you'd like to go and get screened at, and you should be in and out within 4 to 5 minutes. So the health assessment we talked about briefly, all the different types of questions. The easiest, most effective way for you to do this is through our web portal. You're going to be seeing a lot of communication coming out on this. There's going to be an email sent to your emails, and it's going to say the health evaluation is now open for you to pick your time and schedule. You're going to click on the link. It'll have a sponsor code. You'll put that sponsor code in the link. You'll be able to sign your name, your first and last name, your phone number, your email, and go through the health assessment. Again, it's going to ask you a number of different questions related to your health and lifestyle. And then from there, you're able to pick the location that you'd like to screen at and what time you would like to do that. So again, if you pick that time, you should show up. If it's 7:05 in the morning, show up at 7:05 in the morning. You should be in and out within 4 to 5 minutes. To anyone who prefers Spanish, we do have these available in Spanish as well. And for those of you who don't prefer the web portal, we can get these to you hard copy, and there'll be a lot of information coming out on how to do that. You can call our member services hotline, and even if you procrastinate and you don't sign up and you want to screen that day, we do accept walk-ins as well in between those who are scheduled. We want everyone to sign up, so please don't procrastinate, but and you may have to wait a little bit longer if you do show up that day without being scheduled, but you can do that as well if you decide last minute. Again, we talked about the 38-panel mid-arm venipuncture draw. It's very quick and efficient. Different things like kidney function, electrolytes, liver, lipid, complete blood count, glucose, uric acid, and those other smart tests that we talked about, those additional tests, TSH, PSA, A1C. Again, it is a 12-hour fast. We ask that you just drink plain water, although for those of you who can't go without coffee, if you're like me, you can drink black coffee. That may affect your blood pressure a little bit, so try to just remain to that water. But if you need a cup of coffee, you can go ahead and do that. Again, blood pressure will be taken on site. If you have, some people get a little anxious around needles sometimes, which may cause that blood pressure to be skewed a little bit because the blood pressure is taken before the blood draw. You can ask that phlebotomist that day if they can wait a few minutes, or if you can come back in 5 or 10 minutes once your blood pressure may have gone back down after the blood draw. So we do allow for those types of things. I talked briefly about the phlebotomist, but we are sending them to the different locations, and you'll have more information on that. The phlebotomists are actually Interactive Health employees, which is really important to us because we're able to employ these people with a certain level of experience and professionalism. So most of our phlebotomists, I think we have a few that live in the Phoenix area, live throughout the United States and go to our different job sites. But that's all they do all day long is draw blood for our program. So they are very good and efficient at what they do. And every time I've done it with my company, I've been very impressed. So if you're used to going to different clinics and things like that, and you're a little worried about getting bruised, typically these people are very, very good. It's hard to even feel, to be honest. So we talked a lot about the phlebotomist on site, and they are going to be going to most locations, if not all. But for those of you who might not be able to make it, maybe you're on vacation, maybe your specific position or job requires you to be in a classroom at all times, whatever the reason might be, we do allow for members to go to any LabCorp in the United States. So if you're on vacation, you could have this done. I just briefly listed, I don't know if you can see that, and they're not on the printouts. I apologize, because I did this last minute. But there are 3 LabCorp locations in the Prescott area that you can utilize. And the first one is 990 Willow Creek Road, 3155 Stillwater Drive, and 7732 Florentine Road. So those 3 locations alone, you'd be able to go and have this done. We typically leave that test at lab option or LabCorp option open for about a month. So if you are on vacation, it does allow you to go after you get back from vacation or whatever specific thing you have going on where you can't make the on-site phlebotomist. One thing that we haven't talked about yet is how you get your results back. So you will get an email with a link to view your results about 24 to 48 hours after the test is done. So this is pretty quick. In print, we are going to send a comprehensive packet to the home about 7 to 10 days afterwards. So if you and your spouse both participate, you and your spouse will both get a comprehensive packet mailed. And you can compare your results. And if you're like my spouse, she brags about how she's in better shape than me. So those are available. We also have a fax to your physician option. If you do see your doctor regularly, if you do have a doctor that you like going to on a regular basis, you can provide us with his or her information on that web portal, even when you're registering for the event, and we will send your results directly to your physician as soon as they're ready. So that's another nice feature as well. You can also bring that confidential packet, hard copy, into your physician as well. They can read that quite well. There's going to be a lot of different things on the web portal for you to look at, different conditions. There's a WebMD type encyclopedia for you to research different conditions. I always use the example, I didn't know what bun creatine was, right, when I had this blood work done for the first time. So you're able to go in and look at, okay, it might be something affecting the kidneys or liver or whatever. You'll also get a personal health score and goal. Some companies use this personal health score and goal to hold their employees accountable for their health. Prescott is simply asking you to just participate in the program. So if you're a competitive person and you like seeing your results get better or worse every year, you can maybe use this personal health score and goal to help gauge where you're at. This has, though, nothing to do with your company or goals or anything like that. It is just something that's on there for you to track your health at this point. And it is based on blood pressure, LDL, glucose, triglycerides, and tobacco use. Those are all the factors that contribute to heart disease, and that's what we base our personal health score and goal on, just so that you're aware. So Joe talked a little bit about coaching outreach. There's 2 types of outreach that are going to happen after the screenings are completed. The first one is an immediate intervention call about 24 to 48 hours after the test has been completed, and that's done by an interactive health nurse practitioner or nurse. And typically, that call is for something that's extremely elevated. So although you are getting a call, or that individual is getting a call for something that's extremely elevated, we get a lot of great stories out of that because people might be on the verge of a heart attack, people might be on the verge of, or an out-of-control diabetic without even knowing it. And that's only about 3 to 4% of the population. So the vast majority of people are going to get a call from a health coach, possibly, if you fall into the category like I did with a little bit off in terms of blood pressure, diabetes, fasting glucose, things like that, from a health coach about 10 to 14 days after the test has been completed. You can choose not to engage with that health coach. That's completely your decision. But we do see that people make a lot better improvements when they do engage with our health coaches. I get a call from my health coach about every 2 months, and I dictated that she did call me every 2 months. It can be on your schedule on the weekends, with your spouse included, and they're just going to ask you certain things like lifestyle questions. What might be your personal goal? I said I wanted to lose 15 pounds, lower my blood glucose, get back in shape, things like that. So every time she calls me, she asks, how am I doing with that in that regard? And again, you don't have to participate in that, but it is a great resource available to you if you choose to do so. There's other different features on our website. It's something that a lot of these wellness companies are migrating to. There's webinars, there's different resources, encyclopedias, as I noted before. Even if you don't get a call from a health coach, you can choose to opt into those courses if you're interested in it. There's a variety of different courses. Smoking cessation is a big one these days. Nutrition, exercise. There's even different courses on mental health, controlling anxiety, and things like that. So there could be something for everyone on these. Even if you do not get a call, you can choose to do so and use those resources. Again, everything we're talking about is completely free to you as an employee and having insurance in the trust.